Hi everyone, my name is Alexa and I don't know what I want to do when I grow up. Until I figure that out, I'm interviewing professionals in different careers. I created Behind the Career for high schoolers like myself who want to explore different jobs. Today we're interviewing John, who's a sleep doctor, researcher, and professor. Let's see what he has to say about it. Thanks so much, John, for being on the podcast.
Sure, no problem.
Yeah, so my first question is, how would you describe being a medical professor or kind of your field to someone who isn't familiar with what it is?
Yeah, so I could start by saying I'm a doctor. I take care of patients. I see patients with all kinds of different disorders. Often the common denominator is they have a breathing disorder. So my life looks a lot like a doctor that's going in the hospital to treat people with breathing issues. I'll also see patients in my clinic. But one thing you touched on earlier is that I am in an academic medical center, so I teach people who want to become doctors what the job is like. So that might involve doing certain lectures at times or working with residents in the hospital setting. And we also do some research to understand how breathing affects sleep.
Okay, so being a professor as well as research, but also working directly with patients.
Yeah.
Okay, and would you say those are the three main responsibilities?
Yeah, exactly. I mean, some people will call that the three pillars of academic medicine is patient care, teaching, and research. So we do a little bit of all of those things. And depending on what part of that job you enjoy most, you can kind of tailor that. So for me, I probably spend about half my time in research, about a quarter of my time in patient care, and about a quarter of my time in education.
Interesting, so you can kind of choose what you're most interested in and then focus more on that.
Yeah.
Okay, and then kind of taking a step back, how did you know that you wanted to go into being a medical professor and focus on lungs? Was this always something you knew you wanted to do?
Yeah, the short answer is no. It took a lot of different steps. The first step, like many people in your audience, would be to find out or think about, do I want to be a doctor? Do I want to do medicine? And I was certainly drawn to that at a young age, thinking about, I enjoyed science. I enjoyed understanding how things work, but I knew I also wanted to work with people and sort of see a difference that I could make in their lives. So that kind of brought me into medicine and into medical school. Then there's many steps that you go through after that. After you go to medical school, you have to decide what specialty do I want to go into.
Okay.
And you can go into many different paths. Some people go into surgery. Some people go into what we call the internal medicine specialties, or they may go into pediatrics, for example. So for me, I knew I wanted to be a doctor. That took me to medical school. Then I thought I enjoy problem solving. That took me down the pathway of internal medicine. Then I discovered that I really enjoyed more seeing how the body works in real time and solving issues as they come up, and that brought me towards pulmonary medicine, which is breathing. And then from there, I became fascinated with how different things your body does, like sleep, how that affects your breathing and how breathing can affect your sleep. So it was a stepwise thing.
Okay, interesting. And you went into medical school not knowing that you wanted to focus on pulmonary studies.
Yeah, that is correct.
Okay.
Yeah.
And then kind of going back to your main responsibilities, what does a typical day of work look like for you?
Yeah, so it's hard to say. I would say it varies by week. So
Okay.
once a week, you'll find me in a clinic seeing patients in an outpatient center. Most of those patients come in to see me for breathing or sleep disorders. A common thing we deal with is sleep apnea, which is a breathing problem many people get when they fall asleep and their upper airway isn't quite open enough to help them breathe right. So once a week, I'll be seeing patients there. Twice a week, you'll find me in a lab. Maybe not like the way you think about it, like a white coat at a bench, like with a pipette, but doing clinical research. So directing studies to understand how different treatments can help people with sleep problems or breathing problems. And the other 2 days of the week, you'll find me engaged in teaching activities, like working with some fellows. So it kind of varies by day of the week and what I'm doing, but I'm kind of juggling those three different activities.
Yeah, so you're the director of the fellowship. You kind of touched on it. Could you tell us what that looks like and more about what it's like to be a fellow?
Sure. So the vocabulary is confusing. So you start out as a medical student, Then after you graduate from medical school, you become a resident. So that's usually a 3-year process of training in some specialty. After you finish your residency, you may or may not choose to do a fellowship, and that fellowship is an additional few years of training. So where I work, we are bringing people in who are at that fellowship stage. They finished their internal medicine training, they know they want to be a lung doctor, or they know they want to be a sleep specialist. And so I was a fellow once, and what that looked like for me showing up to work was working under the guidance of an attending physician, seeing patients and presenting cases to them and getting feedback about, am I doing the right thing? So that's what I'm doing now. As the attending, fellows will come to me, we'll see patients together, and we'll decide what the plan is and go in and talk to patients together and kind of come up with it. It's kind of like an apprenticeship, right?
Okay,
That's
so
how it
there's no
works.
like curriculum for the fellowship. You just kind of go as you're normally doing research or working with patients.
Yeah, that's a good question. So it's not a curriculum like you might think about, like a binder in a classroom.
Yeah.
But it is a curriculum in that we do have a detailed sheet of milestones that we need to make sure people learn by the time they graduate.
Okay.
So for example, we need to make sure that fellows see at least, 200 cases of this problem or 50 cases of that problem. In that sense, there is a curriculum that you have to check all those boxes into to graduate.
Interesting. Okay. What would you say your favorite part of your job is?
That's a hard one because I have a lot of things I like. I enjoy seeing patients and being able to perceive that I've made a difference in their life. That's part of what sleep medicine has taught me. Like, some people think of sleep medicine as boring because, it's sleep, but there are many people with significant sleep problems and it really impacts their life. And when we can fix something, they come back and they're elated about how good they feel. The other thing that I enjoy is seeing like the look on a learner's face, right? Because in education, right, when they finally understand, oh, this is what all those hours in the classroom meant. Now we're seeing a case in real life, and I'm talking through the case and seeing the fellows learn. So I think those are the things I enjoy the most.
Yeah, we haven't really touched on like the sleep lab, like when people go in and people kind of watch them or study their sleep patterns. Could you talk more about that process and what that looks like for patients?
Sure. So sleep medicine, the main procedure we think about in sleep medicine is a sleep study. And that can be done either in the walls of a building like a hospital. Patients come in overnight and we wire them up from head to toe with all this monitoring equipment.
Wow. Yeah.
We want to see how they're breathing. We want to see what their brain waves are doing as they fall asleep. We want to look at their heart activity. So we're monitoring a lot of things. Most of the time, what we're looking for in those sleep studies is detecting problems of breathing, because it's actually quite common that when people fall asleep, you might have relatives that snore, for example. The snoring is actually a sign that the upper airway is a little bit narrow. But some people have a more severe case where they actually don't breathe properly at night, and that prevents them from getting good sleep. So we bring patients into labs to look for this problem. The other way we do sleep studies is to send equipment to someone's home, and they can actually wear a device on their hand or their forehead and send the data back to us, and we can look at it that way.
And then to kind of close out, what experiences or classes would you recommend to high schoolers or students who are interested in becoming as medical professors, sleep doctors, or researchers?
Yeah.
That kind of.
Sure. I think you got to follow your own heart about what activates you. A lot of medicine is about science. So if you're drawn to the sciences, you like understanding how things work, why things work the way they do, then that's a sign that maybe medicine is for you, and then you would be taking the classes that are required to get you on the pathway towards medicine, which generally are things like biology, chemistry, physics. Also, thinking about how much you enjoy working, with people. I think that's a big part of it. I obviously could decide to essentially focus only on research and not have as much patient interaction, but I do enjoy that. So I think at the stage of people thinking about going into medicine, I would encourage you to not just think about the classwork that's involved, but also, do you enjoy, being with people and trying to solve problems? I think of it as a problem solver, and that's both in taking care of patients in the hospital setting, but also doing research, right? You're trying to understand why are people getting this disease, or why don't we have a better treatment for this, right? It's trying to solve problems.
Great. Thanks so much for taking the time to be on this episode.
Of course. Thank you.